My name is Casey Watson, and this is my final project for Psychology 241. The Epidemic of Teen Anxiety, Parental and Teacher Guidance. What is anxiety? Anxiety is a specific mental illness that causes overwhelming fear and panic. The severity can also range from mild to severe. Everyone at some point in their life will experience some form of anxiety. However, when your fear and worries start affecting your normal everyday routine, it starts to become a problem. When a teen starts avoiding school, their friends, or even family get-togethers, anxiety is something they could be dealing with. Symptoms can include, but not limited to, feelings of panic, doom, or danger, fear, nausea, tingling of hands and or feet, dry mouth, dizziness, and inability to concentrate. Causes and risk factors. The causes of anxiety are mainly genetics and brain chemistry. However, there are quite a few risk factors to take into consideration, especially more for teens. Besides the regular family history for mental illness, or possibly a past unresolved trauma, teens deal with something that parents and teachers never had to understand: social media. Teen anxiety is classified as an epidemic these days, and for good reason. So many teenagers go through everyday life anxious about what is to come. Today, teens can never escape the microscope that is the internet. While the World Wide Web can be extremely useful if used properly, teenagers use it mostly for a popularity contest. Social media and teens. Teens are feeling constant pressure from school, parents, friends, and even social media like Instagram and TikTok. Social media has a great deal of influence over teenagers' lives. The social media influencers that they see every day have unrealistic life and body images that teens think they must live up to. Teenagers must try to remember that these people that are considered to be influencers only post the highlights of their lives and not the everyday bloopers. Parents, it would be beneficial to your teens to monitor what they post and see online. They will most likely see this as unfair and maybe even as a punishment. However, it will lead to a healthier mindset for them, and they will be thankful for this as they age. Teachers, it's easier said than done, but limit phone usage while in school. This will limit their exposure to things that may cause anxiety during the school day. Relationships in the teen years. Relationships could also give anxious feelings to teenagers and young adults. Especially with teens, they almost view a first as a race against their peers. Whether it be a first kiss, a first relationship, or the first time being intimate, most want to be the first among their friends to be seen as cool. That stigma is unhealthy and can give the late bloomers negative feelings about themselves. Teens are going to have relationships, whether it be with parental approval or not. There's a saying that states, strict parents create sneaky children, and to a point that is true. My advice is for parents to stay involved and stay active in their teens' lives and be open to allow them to talk about their relationship questions. Normalizing mental health. My thoughts on the teen anxiety epidemic is simply to be transparent about mental health. Speaking from experience, bottling up any emotions is never good. If people would normalize talking about mental illnesses, most people would not feel ashamed to speak up about what they are going through. Whether it be anxiety, depression, bipolar, or any mental illness, it should not be a taboo subject to talk about. Be willing to try to understand, even if you've never experienced these things for yourself. Your teen or your student needs someone to be willing to just listen to their thoughts and not be called crazy. In conclusion, it is imperative to have that open line of communication with your teen/student. They will most likely not be the first to mention when something is wrong in fear of looking weak or emotional. Whether they act appreciative or not, they will be sincerely thankful for a listening ear and shoulder to lean on. For professional help, there is an anxiety hotline, 1-800-273-8255, 24 hours a day, 7 days a week, to aid in the event of a crisis, such as an anxiety or panic attack.